Sirius XM. It's time for Weird Medicine with Dr. Steve. Weird Medicine.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my intractable woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
Take a scalpel to the vertebrae. I need some suction in the carotid. I bring the crash car and do the kung fu with the shot pack. Dr. Steve.
It's Weird Medicine, or in Spanish, Dr. Esteban Coma Mierda. Wait a minute.
I think that means you're full of shit.
I think somebody was fucking with me.
Who translated that for you?
It's the first and still shit. It's the first and still only uncensored medical show in the history of radio. I'm Dr. Steve, and P.A. John is on sabbatical, and tonight I have my little pal, Dr. Scott. Hello, Scott.
Good evening.
And we have the lovely and talented GVAC.
Bonjour, mon ami.
Addictomy Todd, also known as Fecalicious, the master barber with multiple penis tattoos on his arm.
Howdy doody.
And Ashley in the studio audience, the girl whose name is Ashley.
Yo.
This is a show for people who would never listen to a medical show on the radio. If you have a question that you're embarrassed to take to your regular medical provider, or if you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Visit our website at weirdmedicine.com for podcasts, medical news, and stuff you can buy I can't mention contractually. I wonder if I could get James Earl Jones to do that. POOHEAD.
POOHEAD.
And just throw it in there.
Why
just
not?
every once in a while.
Give it a shot.
And he would go, now why am I saying poo head?
No, he wouldn't. No, he wouldn't. He would say, where's my check?
Yeah, that's right. That's right. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician's assistant, pharmacist, chiropractor, acupuncturist, yoga master, or whatever. All right. So last show, it's a known fact that I'm a dumbass. But on the last show, I started off with I thought I was going to be clever. I was going to tie in the opening with a topic that we were going to talk about. So I said on that show, from the exploding, reconstructed tit capital of the world, it's Weird Medicine, the first and still only uncensored whatever, blah, blah, blah. Well, and then proceeded to do a whole show and never explained what the joke was. So I think most people know, who listen to this show on a regular basis, that my wife had a surgeon mutilate her, or what he called a breast reduction. And he really actually did a really good job. I showed him a picture of Katy Perry's tits. There was something like it was Rolling Stone cover or something.
I want those.
And that's exactly what I said. I said, if you can do this, I'm all in.
Wow.
And he was like, you know what? Yeah, I think I can do that, because Katy Perry's tits are nice and lovely and big, but they were much, much smaller than my wife's tits were. So she went from a double G down to a double D.
Wow.
And so they're still, they look like they did when we first got married. She has a genetic issue that her mother has like triple Z392s. It's just, they're horrendous.
They're the ones that when they have back pain, I'll refer out.
That's right. They're 4 times bigger than her head.
Wow.
And one's like 3 times bigger than the other. It's just all crazy. And my wife was seeing herself going in that direction, because her boobs just got bigger and bigger and bigger, and they were awesome. But at some point, even I had to say, okay, I can see you need to have something done. Mm-hmm. So she did have a breast reduction and reconstruction, and they turned out amazing. They're really, really great. He lifted her nipples up, and still hooked them up so that she can feel stuff, and made the nipples smaller, and they're in the right place, pointing out instead of pointing down, and she's really pretty happy with it. She thinks they're still too big, which means that they're probably just right.
Right. Most women are going up to double D's. Your wife had to go down.
Right. So it was New Year's Eve, and we had a party over here. It was kind of a cancer party. It was Dr. K, and she was just getting ready to have, or they had just had chemo, or were just getting ready to have chemo, and PA Jill, and then Dr. K's husband and PA John. And it was just us, because we didn't want to, they just didn't want to be around a bunch of people, and we were just sort of hanging out and stuff. But at one point, everybody got drunk off their asses, and we were playing that game Dance Central 2 on the Xbox Connect. Mm-hmm. And one of the things that you can do at one point, it goes freestyle, and then you can do this freestyle, and on the Connect it shows an image of you, sort of cartoony looking, doing these movements, right? But then all of a sudden it changes to video and shows you what you were doing when you were doing the freestyle, right? But it's you. It's actually you. And so one of the things that we did, and I actually posted this on YouTube, and if you're interested, I'll put a link on our website, which will be up by the time this airs again. So look for that. But it's called Dance Central 2 Blowjob, or BJ. And basically, PA Jill and PA John were dancing, but they were dancing, and on the freestyle, it's all sort of psychedelic. You can't really tell what they're doing. And then it goes to the video. It just shows Jill just down there with her mouth down by his crotch, just bobbing up and down, giving him the biggest blowjob you ever saw. And it's hilarious. It's just the most ridiculous thing, because it's this stupid cartoony game, right? And then in the middle of it, there's this blowjob action going on. So we were all just kind of getting wild and dancing and doing all this stuff. And Tacy passes out at one point. Well, let me say, she fell asleep. And when she woke up, it was about 3:30. We were all still up, and she said, my right boob is twice as big as the left one. And I'm like, you're out of your mind. And she showed me, and her right tit had it was going to explode.
Wow.
It was twice as big as the other one. They were already double D, so it looked like she had an Anna Nicole Smith implant put in there. That's what it looked like. And it was almost pointing up. It was so huge. And it was rock hard. Not red, just rock hard. And I tried to come up with a bunch of different theories. We put ice on it, not sure what. And I guess about a half hour later, it was like, we got to go to the emergency room, because the pain was excruciating. 10 on a scale of 1 to 10.
Wow.
And so thank God the kids were at the grandmother's, and we were here and not in Asheville, which is where we were supposed to be that night. Mm-hmm. And I took her to the emergency room, and thankfully her plastic surgeon is a guy that just takes call 24/7 for his patients. And he came in, and he had to open up the suture underneath on the crease underneath her breast, and took out almost a unit of blood. Just blood
for everybody
clots.
Out there, what's a unit?
A unit is, if you get a blood transfusion, that's a unit. Mm-hmm. So it's about 500 mLs, which is how many ounces?
It's like a half of a gallon bag. If you like a
it's like a half of a liter.
Rough. Okay.
It's half of a liter. Right. So a quarter of a 2 liter.
A lot of fluid.
But
that's a lot.
When you're talking about packed inside a tit,
that's a lot.
A quarter of a 2 liter bottle is a lot of fluid. And what had happened was an artery inside her breast had actually burst, and just arterial bleeding. Is under high pressure, and it just filled up that tissue.
Wow.
And when he finally evacuated all, you could see the blood spurting out of her boob, through the surgical incision. And he got it closed up and put a drain in there, and she drained bloody, disgusting stuff for about 4 days. Wow. And then it cleared up. And he yanked it, and she's fine.
How far post-surgically was she?
It was 3 weeks, which was the weird thing.
Yeah.
And was it the wee dancing that did it? Just the flopping around?
It was, that's what we're thinking. It was just flopping around, or when she flopped on the couch, or she laid on the couch wrong. But here's the thing. it was going to happen at some point, because my theory is that there was, when you have surgery, you separate a bunch of tissues and then it scars down. And there was a little fibrous tissue in there that was kinking an artery. And as it was shrinking down, it was putting more and more kink into that artery, and she just moved the wrong way, and it just ripped the artery in two.
Right.
So it would have happened, it would have maybe a year later, 2 years later, 3 months later, we could have been, on vacation or on Mexico or something like that. So thank God it happened when it did, and thank God to Dance Central too, because she doesn't do a lot of vigorous stuff right now. It could have happened anywhere. So So that's the exploding reconstructed tit capital of the world, and mystery solved. So
she's fortunate.
Yeah, it's pretty messed up, but she's great now, and they look really, really good. They look really, really good. So
they're real. And
from afar, though, because we still hadn't done it, and it's been 5 weeks. So I'm just looking at them and salivating. The other day I was like,
clearance for that, Jeff?
Let me see if your nipple has, if there's still sensation. I'm getting down there, licking them and stuff. Can you feel that?
What's the joke where the woman comes home and says, "Honey, I'm sorry, my gynecologist said I can't have sex for 5 weeks." And he says, "Yeah, what did your dentist say?"
Get it? Blowjob?
I do, I get it. See, because that's very good. That's a good joke. I want everybody to go to Amazon.com and buy Mr. P. That's Patrice O'Neal's new CD. And you can go to Amazon.com and get the CD, or go to iTunes and get the files. And it's very reasonably priced, and the proceeds go to his family. I really want to thank the people who donated to our website before the holidays, because none of this stuff was set up. That's why we're not taking donations anymore, because we were just doing it as a stopgap to get things started until Mr. P would come out and the Audible thing happened, and Jimmy and those guys and Jonathan Brandstein may set up a benefit at some point in the future, and we don't want to interfere with all that. Right. But our listeners, in just the space of about a week and a half, 2 weeks, donated over $1,000, which doesn't sound like a lot, but right at Christmas time, it was a big deal, and it was a big deal to his family, and they really appreciated it. So I really want to say thank you to everybody out there who contributed, and to all those people out there that didn't, that have good intentions and who love Patrice. We all loved Patrice, so that was a really cool thing that you guys did. So thank you for that. We are in our new time slot, 9 p.m. on Saturday, at least this week.
And then
how long? 9 a.m. on Sunday and 5 a.m. on Monday, which the 5 a.m. on Monday sounds like a terrible time slot. It's actually not. The last 15 minutes of our show gets heard by a whole lot of people, and there are a bunch of people
I would think,
that are up at 5 in the morning.
And all they need a strong lead in,
Yeah, that's right.
Until they hear this show. After the show, we may not.
Well, we may pick up a few folks that tune in a little early for O&A and then decide they can listen to us.
Yeah.
That'd be nice.
So anyway, all right. Where are we?
Number one thing, don't take advice from some asshole on the radio.
I want to talk at some point about this penis tattoo that gave a guy a permanent erection, so if things slow down, just remind me of it. All right.
Hi, Dr. Steve. I'm a 38-year-old woman. I have a bunion on my left foot that has gotten progressively worse as I've gotten older, and probably in the last year and a half, I've noticed more of my big toe actually moving, shifting to the left, causing a corn between my big toe and my second toe. Just wondering if it's something to live with. I did go to the doctor, and he said that surgery is an option, but I've also heard horror stories from people that have had the surgery, and just wondering if it's fixable or if it's...
All right. Yes. Sorry. It is fixable. A bunion is basically, well, you deal with bunions.
I do, but I get the horror stories typically. I get the ones post-surgically that that didn't fare so well. But
Okay.
certainly the bunion surgery I think is a great.
Well, and bunion is an enlargement of the first joint between the big toe and the foot.
Mm-hmm.
And it's an angulation, too. So it's not just an enlargement, but the big toe will angulate away from the midline.
Mm-hmm.
And so you get this sort of sharp angle there. And it hurts to wear shoes, and it hurts to walk on it. And you want to go to an orthopedist that deals with feet, or a podiatrist. Podiatrists do this surgery.
And very well.
And she said that she's heard horror stories. I actually haven't heard horror stories. I know you see some of the failures.
Yeah, I get the failures.
I've seen quite a few people who have had it done and have been very satisfied with it. And it's a relatively simple surgery. And
it's just a realignment. It's a cut and a break and a pin, and typically people do really, really, really well.
Yeah. Now, Dr. Scott is, I don't think I introduced you properly in the beginning. He's an acupuncturist. He didn't just go and take a 2-week course. He actually went to Chinese medical school.
Yes.
And how many years was that?
4 years.
It's a 4-year medical school.
Yeah.
And where was it?
In Houston.
In Houston.
Yeah.
So you moved to Houston and went to Chinese medical school?
I kind of like what is it, the Beverly Hillbillies. I packed up all my stuff here in East Tennessee and moved to Houston, and I went to a traditional Chinese medical school, and it was a magnificent program. But I see everything that you would see in a traditional allopathic clinic.
Right, allopathic being
Western medicine,
traditional Western medicine,
which is what you do, and I just look at it from a different approach.
Yeah,
and the thing I tell you, and I tell all my patients, and certainly you know me well enough, is that I always preach, work it up. Go to your primary doc. Let's see if you need an X-ray, if you need MRI, CTs, blood workup, whatever. Get that stuff and bring it to me. And that's the way I was trained. I was trained to work in a westernized society, but do traditional Chinese medicines and acupuncture.
Yeah.
So, and again, I think I send people out for bunion surgeries that have done marvelously well. I had a lady, just speaking of a failure the other day, I had one that had...
Be careful where you are probably bound under HIPAA rules, so just be careful and make sure she's not identifiable.
No names.
Okay.
But she had bilateral bunionectomies.
Yep.
One side was perfect. I mean, just perfect. She couldn't have been more pleased. The other side, she had RSD.
Okay, reflex sympathetic dystrophy.
Yeah, and it's a hideous, kind of intractable neuropathic pain. She came in to see me.
We're talking to a lay audience, so he's talking about it. Basically, it causes changes in the circulation and also in the nerves to the affected limb. And I've seen RSD so bad that actually caused the limb to shrink and shrivel and the skin to tighten so that they couldn't even move it anymore. That's the most severe form of it.
It's the worst, and typically it follows a perfect surgical procedure.
Yeah.
And it's just
happens.
bad luck. Yeah, it's just bad luck, which is easy for us to say.
Or minor trauma can cause it sometimes.
I had one with the lady dropped a hammer on her toe one time. I had one got a foot stuck in an escalator, but this just so happened that she had falling to bunionectomy. But anyway, I treated her one time, pain was gone. She's good. Both toes are great. So I wouldn't hesitate to do it.
Yeah.
And I think the younger probably the better. The more quickly you'll heal.
I am a proponent of acupuncture. I send people when traditional Western medicine fails. It's weird. Like I used to have people in my office that I had done this test and that test and done everything I could think of. They still felt like crap. I couldn't find a reason for it that was explainable with Western medical techniques. I'd send them to Scott, and he'd say, "Oh yeah, they're." Malodorous humor is,
they got rebellious stomach cheese.
In the Framaham and all this stuff. And then, but he would have a diagnosis that fit the model of medicine that he uses, and he would have a treatment for it. And hell, they'd get better. They'd come back to me saying, "Yeah, I feel better," which ultimately is all that you care about. That the patient gets better.
Absolutely, and I know my place, and I respect the fact that Western medicine having an MRI or having a surgical procedure is a wonderful thing.
Yeah.
Come to see me after you have your heart attack, not while you're having your heart attack.
Right.
Let me see you after.
Yeah, those are things that we've learned that we can modify the disease.
And you do well. And I'm thinking of a case we had years ago in Rogersville. The lady had the MI's posterior wall. Oh yeah, I'm sorry. But anyway, we a case we had years ago that she did really, really well with Western medicine and traditional Chinese medicine, and she was having a lot of pain. You sent her to me, and she did famously.
Yeah.
Are these bunions and corns like just the natural occurrence, or are they caused because of improper footwear and things like that?
I think I'd like to have P.A. John in on this one.
Yeah.
I think it's more genetic and predisposition that way than it is footwear, but I may be wrong on that. I've never seen a study that showed that wearing high heels causes bunions. It's just something that
or just too tight shoes or something. I was thinking.
Yeah. Unless you're Japanese back when they used to.
When they bind your feet. Right.
I don't think
you're doing
there was a
foot
genetic
binding.
predisposition of that, but certainly there was an environmental factor there.
Yeah, and I think a lot of people don't know what you're talking about. There was, and I don't know which culture it was that did it, but it was some Asian culture that would bind feet.
They would break their metatarsals.
Okay, the metatarsals being the long bones of the foot.
They would.
I'll translate for Dr. Scott.
They would break the foot in half and then fold it under, and then wait for it to grow a little bit, and break it and fold it under again.
And then bind it so that you had dainty little feet, but they were unbelievably painful from what I hear.
Yes, jeez.
Can you imagine?
No.
So, all right. So get that bunion checked by a podiatrist.
Absolutely.
All right, let's see here.
Yeah, I'd like to know why your poop is different colors. Sometimes it's real black, and then sometimes it's a real light brown, and what causes that? Thank you.
And we've got a follow-up question to that, or a similar question.
Hi, I was just wondering, for the past week or so, I've woken up and went to the bathroom, and my poop is dark green. I was wondering what causes that. Thank you.
Okay. So the first guy just simply asked, what causes the spectrum of colors of stool? And then the second guy had a very specific question. He has dark green poop. So let's talk a little bit about the spectrum of hues that you can have in your stool. And then I know what the answer is for the dark green poop. The things that cause stool to have different colors, it's basically, poo is digested food and bacterial bodies with some bile and a chemical called stercobilinogen mixed in. And stercobilinogen is basically the pigment in bile that makes stool brown. So you can have clay-colored or even gray stools if you block the bile duct. So if all of a sudden your turds are white or gray or real light clay-colored yellow, that may be a sign that you've got a gallstone or something like that that's preventing bile from getting into your digestive tract. Things that will cause black stool are Pepto-Bismol, iron supplements, but also blood in the stomach. So anytime that if you have black stools more than once or twice, I would get that checked. A doctor can take a very small sample, do a thing called a fecal hemoccult, and it's basically you put some fecal matter on a little piece of paper that's got special chemicals on it, and then they drop a developer on there. If it turns blue, there's blood in it. And if there's blood in it, then they got to see where it's coming from. If it's black stool, it's very likely coming from the upper GI tract. And so they'll recommend an endoscopy just to see if you've got a bleeding ulcer or something. So don't ignore black stool.
So that's why red blood is better coming from your rectum than black.
Well, yes.
We sort of talked about this last show.
Typically, bright red blood that's just on the toilet paper is going to be some sort of anal problem like a hemorrhoid,
a fissure,
or something like that. Although, having said that, if it's swirled in with the stool, it could be from farther up in the colon, which could be from a diverticulum, which is a pocket that pooches out of the bowel, which we've talked about multiple times on the show. Those things have a real thin skin and they can bleed. It can also be from a tumor that's bleeding. So you don't want to screw around with it. You know, if you see that, it's wise to get it checked out. And so they can just go, okay, when you bleed, it's diverticular, or when you bleed, it's hemorrhoidal. At least get it checked out the first time.
Yeah, and that's what I say. We differentiate kind of interesting between near blood and far blood.
Oh, really?
Yeah, which is a Chinese kind of diagnosis, which again is kind of broad, but typically the near blood is going to be anal fissures, as you said, hemorrhoids. But and certainly
so that'd be blood separate from the stool,
completely separate, and then certainly a far blood, which is again it's kind of a strange thing, but we would call it something typically in the upper part of the GI tract, the stomach, or and either way I send them out. I'm like, if you've not had this worked up, work it up first. Yeah. And if everything's clear, then you come back and we start figuring out what we can do. Yeah. Kind of naturally.
Yeah.
To work it up.
So now green poop, dark green poop. I have personal experience with this. Talked about it a couple of years ago on this show.
Should we raise our hands for everybody's had green poop?
Well, what he's talking about in my mind is emerald green poop, dark green, like an evergreen color. And one time I was changing my kid's diaper, and he had the most lovely green-colored feces in his diaper. And I figured it out. It was coming from this yogurt, this kid's yogurt that I had that was blue.
Oh, yeah.
It was like Kix yogurt or something like that. And it turns out that when you mix blue dye that is not digestible, in other words, it doesn't change color as it goes through the GI tract, with yellow bile, you get green stool. And it is a very lovely dark green color. And you'll find it in all kinds of weird foods that have artificial colors in it. Kids' yogurt, cereal, stuff like that. I emailed this guy after he called, or I texted him. And I said, usually it's cereals or something like that. He said, yeah, I've been eating Kix cereal. And that's one of the ones that's notorious for causing green poop.
I was going to say pistachios. I've seen people with pistachios, the green pistachios cause the green poo.
Yeah, because, but that's right. And sometimes spinach will do it too if you eat enough of it and it goes through relatively undigested. So, but pistachios. I would think that you'd be seeing green chunks in your stool.
No, I'm talking like kind of it's like it stains the poo.
Really?
It's like those artificial kind of pistachios. It's not like
I don't know what the hell you're talking about.
Green poo. At least it's not an infection. That's all that matters.
Now you know how we feel when you talk.
Yeah.
Hey, Dr.
Really?
Shit. From Ithaca, New York. I was wondering if I could just get your opinion on penis enhancement methods, like pills that you see advertised on TV versus something that, may not have been touted so much as something interventional, invasive, like surgery. If you could just let us know about that. Thanks. Take care.
All right. First thing I'm going to say is if any of these things worked, I would have used it already. No joke. I mean, we get asked this question frequently. It's something that people are really interested in. And if you go to xnxx.com or one of those websites, there's these guys with these 3-foot-long dongs going, look, you can have one just like this. And, one simple secret. And, and you can have a penis like this. And it's like, none of it works.
Right.
I've looked at peer-reviewed literature for anything that causes any kind of lengthening in the penis or increase in girth, which would be just as good, and have found nothing except for 2 things. And one was surgical. I can't recommend it because it only caused like a 1 centimeter enlargement, which is less than, 2.5 centimeters is an inch.
Mm-hmm. Yeah. It's like the length of a cuticle.
Yeah, right.
If you listen to last show.
And the other one is this device that's a stretching device that you put a Velcro ring about the base of your penis, another one under the head, and then it's got these turnbuckles. You know, they're these steel rods with little screws on them,
Jesus.
and you just gradually stretch the penis more and more and more, and you wear this thing all day long.
Sounds kinky.
Man.
Yeah, I was going to say it sounds either horrible or like a lot of fun. I'm not
I think
sure
there are
which.
some people that would find it, you know, like body modification. They would find it, you know, sexy to walk around with this thing in their pants. But it'll make you look like you've got a rod, you know, all the time when you're walking around with it. But again, the maximum lengthening was like 1 centimeter, and they were using it in people who had Peyronie's disease, that a curve in the penis, trying to straighten it out. It didn't work for that very well either. So none of these pills work unless they advertise on this channel, in which case the jury is out as far as I'm concerned. I'm not commenting. But all the other ones out there, just we don't have any evidence that they work at all, and a lot of them are just herbal remedies that you could
use for the wrong reasons.
Yeah, that are like. Well, do you guys use horny goat weed?
Absolutely.
Okay, now what in traditional Chinese medicine, what do you use horny goat weed for?
You know, it's more for if you have an arousal. So it's more if you have an arousal issue. It's certainly not for growth. It's very similar to the ephedra. You know, they started giving ephedra and all these crazy supplements you can buy at the over the counter for energy, and that's not what ephedra is good for. Ephedra is good for asthma, you know, and we used to use that in clinic all the time for asthma. And they've taken
traditional Chinese
medicine, in
not in
small,
allopathic
no,
medicine.
not in allopathic medicine, but in traditional Chinese medicine, and they took away a wonderful medicine for us to treat asthmatics, certainly acutely. Because they're using these medicines, you know,
in the supplements.
In the supplements, you know, you have the horny goat weed and him beans, and you know, the way I was trained, we actually had it's called I think Ruzong, I want to say, which was a immature deer antler, and you shave it off, and we cook it up, and it helps with erectile dysfunction. In small doses, it's okay, but it's not going to increase length or girth or anything like that. It's all about function.
And that one seems to me like it's a metaphor, more than anything else. Like rhino snout is supposed to be one, and then the deer antler, because it looks like an erect penis, it must work. You know, most of the stuff that you do, I have great respect for. Some of the stuff I just think is malarkey, and that's to me is very testable. You know, you could do a test and see if it's placebo. The first thing is it ain't hurting anybody.
No, it's not.
You know, taking powdered deer antler isn't going to hurt anybody except the deer you took it off.
And if it makes them think they're going to get a huge erection, and they do,
and if that's all it is, and if you think that there's a real physiologic effect, I mean, more power to you. But it is one of those things where Western medicine and Eastern medicine can meet when you do the double-blind placebo-controlled study and see if. And now, again, though, that fits our model. And the traditional Chinese practitioner may say, well, you know, that's bullshit because we know it works and we don't care about your double-blind placebo-controlled studies. I don't know, you know.
I agree.
But, you know.
But I think, you know, find out if there's some sort of underlying, you know, pathological issue.
Sure.
You know, and if you clear that, then explore everything you can do. And I think that's very practical.
Yeah. Yeah. And, yohimbine is known to work for some people for erectile dysfunction, and it comes from the bark of some tree in South America. I don't know if it's in Asian medicine as well.
It is to a certain, and what we're starting to do is incorporate some of those things that, you know, through modern research, you know, Chinese medicine's changed a lot.
Yeah, it's not just stuck in 4,000 years ago.
Exactly. Yeah, I mean, it's not 3,000.
That would be insane, because it would be like us still, you know, having people bite bullets when we saw their leg off with a rusty saw.
No, we've come a long way. We've come a long way, especially in the last 10 years. You know, I think when you and I first met, you know, a lot of the research was being done in China, and there was not a lot of great research being done. But now, the NIH does a lot of double-blind, placebo type research that's shown a lot of efficacious results to.
Why not just use Viagra though? Why do we have to use the fucking deer antler and the yohimbine and stuff?
Why something created by a chemist, though?
Well, my thing is, what does deer antler cost?
A lot more than Viagra.
It does. It
really
costs more?
Absolutely. Yeah, it's just because
it costs more than Viagra.
Oh God, yeah. But because you got to figure it. But here's
that's part of the placebo effect.
Yeah, but here's the intriguing thing between what Dr. Steve and I do is he is so good at treating very specific things that you can measure, and I'm really good at treating things you can't.
That's true.
And if we've got somebody that we know they're medically clear, nothing's wrong with them, but they're having some issues, maybe it's a psychological issue with erectile dysfunction, you can give them a Viagra or a Cialis and they do wonderfully well.
Yeah.
Versus if there are some underlying pathologies, you send them to me, because I've got the way my medicines are set up is we can give you a medicine that's got maybe 10 different approaches to why. Maybe it's your disturbed shin, which means you're disturbed, but your liver chi stagnation. And it sounds kind of crazy, but the bottom line is my medicines work differently than his do.
Right.
And it's like I said, I promise you one thing.
As long as they work,
it doesn't matter. Just find somebody that can make you better. That's the key.
Yeah. So, Steve, you don't believe in chi and the meridians that it flows along in the human body?
Well, okay, here's the thing. People talk about life energy and life force energy and stuff, and how they're manipulating it with their treatments like therapeutic touch and stuff like that. These are fields that have never been measured. Now, the Higgs boson field has never been measured either, okay? Mm-hmm. But that's what they're doing with the superconducting super collider.
Right.
We're actually looking to try to find the particle that mediates that field. Mm-hmm. The bioenergy fields, we've never found anything, to support that using Western techniques.
Exactly.
See, that's the thing.
You're very skeptical, but you're looking at it through different...
Yeah, I'm looking at it through, Western science eyes.
Mm-hmm. Exactly.
And, the thing I have respect for anybody who does a time-honored technique, or even herbalism, as long as they have put their time in and they're not just taking a 2-week course so that they can practice medicine without a license. That's what pisses me off.
Of course.
Now, someone like Scott, he does his thing. He's very successful at it. And like I said, I don't know if we talked about this show or last show, but I've sent him all kinds of patients that I couldn't make better, and he made them better. Not every time, but enough times that it was worth doing. And one thing I have an issue with is Medicare is so into the Western model that they won't pay him to see patients. He has to work on a cash-only basis, except for a few insurance companies that will pay an acupuncturist.
That are getting better. And I think a lot of the insurance companies, and certainly workman's comp cases, are getting better.
Yeah.
Because you just realize there's a lot of efficacy, and there's a lot more research behind the way acupuncture works, which is really nice.
Yeah.
So, if not, they can pay me cash.
And
cash works.
And he charges a lot less.
Yes.
Right.
I mean, what do you charge for an office visit now? And then we'll move on because I know people are yawning.
It's $80 for the first visit.
Oh shit! It used to be like $25. What the hell happened?
Hey, it's 9 years down the road. I'm a lot.
Has it been that?
Well,
God.
Yeah, God.
It has been 9 years, hasn't it?
Yeah.
Yeah, but it's still, you go into a regular allopathic doctor, it's going to be $150, and for your initial visit, it might be up to $300 something.
Absolutely.
So,
wow.
Yep.
So anyway, all right. And we got one for double vasectomy.
Hey,
Tom.
Dr. Steve, this is Brian from Ohio. I just had a question. I normally shave my head and face except for a goatee, and if I let my hair grow out just a little bit for like a week or so and then shave it, I get red splotchy areas that really itch, and it makes me want to shave again. I'm wondering if this could possibly be psoriasis or anything like that. I'd just like to have your advice on that, what this could be. Thank you. Bye.
Well, if he's just got redness of the skin, that's not psoriasis. Psoriasis, he'll have big flakes, and there'll be stuff coming off of there. It sounds to me like he's basically, if you shave a hair that's extremely short and close to the skin, you have less resistance to the razor. You're not doing as much... well, how can I say this? It's less traumatic to the skin, to the follicle.
Okay.
A longer hair, you're having to use more pull, more pressure to get it to get the sharp blade to go through there. And plus you're loading the razor, which is the debris from the cream and the hair and all the dead skin cells and all that stuff. So you're just making your razor work harder, and it's harder on your skin. So I would just recommend that if he's going to grow it out for a little while, get himself a little trimmer or a little something and remove the length of the hair and then just shave the stubble.
Huh.
Now, the other thing...
Hell, I learned something today.
Well, the other thing he can do...
Who would have thought we would... never mind.
Yeah, who would have thought a barber would ever teach a doctor anything?
Just the one particular barber.
Yeah, the other thing I would recommend he do is look into using a shaving oil. It's really good. It lubricates the skin, and it makes the razor glide a lot more easily. It also gets into the cuticle of the hair and softens it, so it's easier to cut. And the other neat benefit
You
of
use
a
that
shaving...
instead of cream or with cream?
I'll explain.
Okay.
And I'm
sorry, didn't mean to interrupt.
No, I'm sorry. No, I just
I'm learning something here.
No, the other neat benefit of a shaving oil is especially with shaving, you try to use hot water and steam.
Mm-hmm.
If you put soap on your skin and then you open up your pores with hot water and steam, then that alkaline soap gets into your skin and dries it out, and that could be contributing to the problem. A shaving oil will create a barrier, and that oil, which is naturally moisturizing, will keep the soap from getting down into your pores and drying out your skin. So I recommend that. What you want to do with oil is apply it. Normally I would just apply it onto the skin and then apply my heat and my moisture. If you have a chronic problem where you really have a lot of irritation, I would apply a little bit of moisture and heat first and open the pores up a little bit, then put the oil on.
Okay.
But either way, put the shaving cream on top of the oil, because the shaving cream serves a different function. On top of lubrication, it also stands the hair up, and that's why you want a good thick shaving cream to keep the hair standing sort of at attention. So you get a good angle with the blade. You're not cutting an angle with an angle, you're cutting to a 90 degree.
Okay.
In other words, you want a 45-degree angle on your blade to a 90-degree on the hair if you can get it.
Yeah.
Or as close to that as possible. It's the other reason why long hair, the weight pulls it over, so you don't get that good angle.
Yeah, you got
Shaving's more about prep than anything else.
Yeah.
It really is.
90% of our audience is male, and I will guarantee you that the vast majority of our audience has been shaving for years.
And most of them are doing it wrong.
And everybody out there's going, well, hell, I didn't know that.
Yeah, most of them are doing it wrong.
Yeah, who knew that there was all this complicated, shit with shaving?
The reason why is most men's skin can handle it.
Yeah.
And so you might get an occasional bump or an occasional little bit of irritation, but it's not a chronic problem for most people. But there's a percentage of men with either a really coarse beard or a really tender skin that get a lot of irritation, and that's where these things can make a huge difference. But it's good for everybody, especially the keeping the soap out of your pores.
All right. So you don't think he has tinea barbi or anything like that because of the
Well,
redness?
tinea barbi's barber's itch, and there's a lot of different causes for barber's itch. If it's happening on his head, I would expect it to be poor shaving technique. If he does the things that I've talked about and it doesn't get any better, then obviously he wants to go to a doctor.
Yeah, okay.
I don't know if you heard, but I actually had a haircut and shave from Todd.
It's G-Vac's Big Gay Haircut.
And he did the hot towels and the oil and all that stuff, and yeah, it was fantastic.
And then did you get any bumps?
No.
And then he tweeted afterward, I had the most amazing.
Hey, I'm giving my buddy a plug. What do you
That's
want?
right. He's helping me out, unlike you.
Hey, Doc, it's Blowhard. How you doing? Listen, I have a friend of mine, and he's got a really weird medical problem. Let's just say his name is Evac.
This son of a bitch.
He confided to me that he has 3 scrotums. He says the chicks love it. And he says he can splooge a lot extra fluids, and he can go longer and deeper into the night. With, this whole thing sounds nutty to me.
Sick bastard.
Nutty.
Is he in danger? Is this something that's going to definitely make him sick?
This is his
something
question?
That's just a freak? Is it common to have 3 balls?
There's something seriously wrong with
My
this
friend
man.
really needs help because he's out of control with this, and I'm pretty sure soon he's going to join a sideshow. So let me know what you think about the friend of mine who's got...
Okay, this goes on for another, 3
Oh,
minutes.
of course.
Yeah, well, it's Blowhard.
Is that true?
No,
You have
of
to-
course
okay, I'm just making sure. Well, if you had a third testicle, I thought
I'd
maybe,
whip it right out and show you.
I would prefer not to see it, but we could talk about it and maybe reassure you in some way. For people who do have a third testicle, very often it's a fluid collection called a hydrocele. And you can tell if it's clear fluid or not by taking a pen light and putting it behind it and shining it through. And if it lights up, as P.A. John says, like E.T.'s finger, then it's very likely to be clear fluid. And most of the time, those can be left alone, although if it's big enough for you to see, it's big enough for a doctor to look at and just make sure it's nothing else to worry about. It's the small ones that if you have a roughness, and we haven't talked about this in a while on the show, so I thought I would take this opportunity to do our yearly Check Your Stupid Nuts for Lumps show. So what you want to do is get your sack out and start to just move the scrotum around with your hand over your testicles, feeling every surface of the testicle. Start on the...
Or as I call it, Saturday night.
Shit.
Yeah.
Why didn't I think of
every square inch of that testicle?
Well, let me see here. I can't do it. Wait a minute.
Got any Barry White?
No. But... So take your testicle. That's not going to work. Oh my God. That's Fezon Niscotzi from. Anyway, okay. I just kind of lost track of myself there for a second, thinking about examining my own testicle. You want to take the skin of the scrotum and with one hand move it around, feeling every surface of the testicle itself on the right side, then on the left, or vice versa if you happen to be left-handed. Now, you're going to feel a few things that are normal but may shock you the first time you do it, and that is a somewhat tender place on the back side of the testicle called the epididymis, and this is where all the tubules from the testicle collect and then collect into a tube called the vas deferens that takes sperm cells from the testicle up into the body so that you can ejaculate them onto the floor or into a tissue or into someone's face. Yes, thank you. So that is sort of a mushy, tender thing, and just above it you may feel a thing called the appendix epididymis or the appendix testes, which is just a little lump up there in that area that also is going to be tender. If you feel a lump anywhere else, which may feel like a grain of gravel that you might find in an aquarium, aquarium gravel, something like that, or any other lump, then that needs to be checked by your doctor, and just go see him. Testicular cancer is a young men's disease, and no one teaches young men how to examine their nuts. Every girl knows how to examine their breasts because it's crammed into their head from the time they're 18 on. And every girl knows that when they hit 40, they need to start having mammograms and all this kind of stuff, and their doctors are checking them. Most doctors that I know have never checked a 15-year-old scrotum to see if they have testicular cancer. And when I was in another state, I had a kid that, as part of my routine exam, I always told him, check your stupid nuts for lumps. And he came back one day and said, "Hey, Doc, remember when you told me to check my nuts for lumps? I found one." And in fact, he had a testicular cancer, got it removed while it was still stage 1. And, he's, as far as I know, alive and running around today with one nut. But, who gives a shit?
Yeah.
He's alive.
It's weird you mentioned this topic because just a couple of weeks ago I was talking to a friend of mine back home in New Jersey. Hadn't talked to him in a while. How's everything? How's your wife? How's this? How's that? He's like, yeah, I went to the doctor. He goes, I found a lump on my nut, and he was scared to death. You know what I mean? He was shitting a brick. But I talked to him recently, and he said the doctor said it's nothing. It's some kind of cyst. It's nothing to worry about. And that's what I thought because he's in his mid-40s, and I didn't think.
Yeah.
I thought like you said, it was a young man's thing, but he found a lump, and then he went to the doctor, and he was shitting a brick till he found out for sure.
Well, good. I mean? Well, I'm glad they checked it out and it was okay.
Yeah.
It's most things that you'll find in your sac are benign. There's this one thing that when you feel in there, if you feel like a bag of worms, that's called a varicocele, and that's where the veins that go around the vas deferens that carry heat away from it actually become varicose or enlarged, and they'll get really big. And most people who have a varicocele will be sterile in that testicle. If it's in both, you may actually be sterile. And if you want to have kids, you have to have that varicocele removed, and even then may not restore your fertility. Wow. But so you feel the bag of worms, it's a varicocele. If you feel a third nut and it's above your testicle, it's most likely a hydrocele. And if you feel anything, and any of these things should probably be checked by your doctor. We have 1 minute, so just throwing that out there.
Is the sterility due to a lack of temperature control due to the varicocele? Because I know sperm are produced at a really specific temperature.
That's right. It's 3 to 6 degrees below body temperature. That's why your nuts hang outside the body. And and who knows why the hell that is? What in evolution caused us to need to have our sex organs hang outside our bodies while women can run around and ride a horse and stuff and have their sex organs on the inside of their bodies, and they're not going ow, 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 ow. As a matter of fact, they're going
yeah.
Thank you, Ashley. All right, many thanks go to Dr. Scott and the lovely GVAC addictomy Todd, Ashley, and really appreciate Eric Nagel and all those guys. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Comfortably numb. Weird Medicine. This has been Weird Medicine with Dr. Steve. Weird Medicine. Got questions for him? Visit him at drsteve.com or call 347-766-4323. That's 347-POOHEAD. Our real phone number, chosen by a grown man in the medical profession. Sirius XM.